Let's bring in Dr. Tom Balcezak, Chief Clinical Officer of Yale New Haven Health. Good morning to you. Thanks for being with us.
Good morning.
So I guess let's start. When do you expect the vaccine to arrive at your hospital, and how soon do you think you will start actually vaccinating people?
Well, we've heard that Pfizer has received our order, and they will tell us when it's shipped, and we will be tracking it. And as soon as it arrives, within hours, we'll be ready to vaccinate.
So starting out, it's a limited number of doses. Who will get this first round of vaccines in your hospital system?
So we've determined that anyone who cares for patients should get this vaccine. And so in our institutions, that's about 26,000 people. So we're going to have a priority to the individuals that have been caring for COVID-19 on the front line. So folks in our emergency department, and I mean all folks, whether you're a technician, whether you're checking people in, whether you're a nurse, a pharmacist, if you come in contact in one of these high-risk areas, you get the vaccine first. A little bit like the travel lines, where when you're going through screening at TSA, there's the pre-check line and there's the regular line. We're going to put the folks that are in these high-risk areas in that TSA pre-check line.
So the logistics of all of this are very complicated. The transportation, the storage, the distribution of this vaccine are complicated, to say the least. What has your hospital done to prepare for this moment?
You know, we were involved in the Pfizer clinical trial, so we have experience in the freezing, the thawing, the dilution, the transport of this particular vaccine. But we also have other drugs and things that we keep at ultra low temperature. So we've got folks that are skilled in this. We've got the equipment, and we think that there's really no unsurmountable challenge here for us.
And just to be clear, do you think you'll start that vaccination process this week?
Absolutely.
And I'm curious, hospitalizations, they're up across the country. It's also flu season right now. What are you seeing in your hospitals? Is it busier than normal, or is it similar to years past?
Absolutely different than years past. I mean, this vaccine, it's so long awaited. It's so appreciated that we're getting it now because we need it. We have right now in our health system about 450 patients with COVID-19, which is a little more than half of the surge that we saw in late spring. But still, we also have all of the other kinds of conditions that we treat. And, you know, unfortunately, a lot of people delayed care in the spring. So we're still playing catch up with a lot of stuff that wasn't done in the spring when people stayed home. And it's important for folks to know that they need to get the care they need. They shouldn't delay seeing a physician if they have symptoms or concerns that they want to check out.
Now, that domino effect of this pandemic. Dr. Balcezak, thanks so much for being with us this morning. We appreciate it.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.